Today we are going to talk about the benign tumors and malignant tumor. So first of all, what is benign tumor? So a benign tumor is a tumor that will be well differentiated, that will not metastasis to any different organs, that will not invade the local structures, and that will have close resemblance with the normal tissue. So what are the benign tumors? They are those tumors that stay in their primary location without invading other sites of the body. They do not spread to local structures or to distinct part of the body. It means there will be no stasis, no metastasis. The benign tumors tend to grow slowly. They have a slow growth, not like a malignant tumor. They have aggressive growth. And the benign tumor have distinct clear borders. They are capsulated, and they have a specific distinct border. They will not have irregular borders. The benign tumors are not usually problematic. They will not that much cause problems. But some endocrine tumors, if they are benign, they will release a lot of hormone. That hormone can cause different signs and symptoms in a person. Most benign tumors form encapsulated or circumscribed masses that expand and push aside the surrounding normal tissues without actually invading, infiltrating, or metastasizing. Benign tumor end with oma. So it's mean, for example, if I draw like a tumor here, for example, these are the cells. Now, there are a lot of cells, they are producing from this cell, which is not under the control of body, but they have similar structures. They have capsule. They are not invading to surrounding structures. They are not going to metastasis to different location. Rather, they have, if it is endocrine, they will produce a lot of hormone, and they compress the surrounding structures. That can lead to different manifestations. So what are the characters of a benign tumor? A benign tumor, microscopically different features. So what are the features that we can see? So their organized growth, they have a organized growth. Uniform nuclei. Nuclei will not be so much atypia. There will be no so much atypia. Low nuclear to cytoplasmic ratio. Minimal mitotic activity. Mitotic activity will be there more than that of the normal cells, but less than that of the malignant tumor. Lack of invasion. They will not invade the basement membrane or the local tissues, and there will be no metastatic potential. So they will not metastasis to different organs. What are the clinical significance? They can compress or compression of the surrounding structures and organs. They can cause obstruction effect. If the tumor is arising from the duct of the gland, they can cause obstruction of the duct. Endocrine tumors may have hormonal effect, as I said. If the tumor is growing from the parathyroid hormone, parathyroid adenoma, or from the thyroid follicular adenoma, those can cause release of parathyroid hormone, thyroid hormone, and there will be symptoms and signs of the hormone, excess hormone. That can be the clinical manifestation. So in this image you can see that this figure shows villus adenoma, which has grown into the lumen in a form of papillary fronts with stromal core covered by moderately dysplastic epithelial cells. The underlying muscularis mucosa is intact, and there is no downward spread of the tumor. So if you see in this image, so these are the adenomas, these are the adenoma in a papillary form. So this is what we call as the villus adenoma. They are going toward the lumen. And these are the glandular structures. Which type of cells? These are the columnar epithelial cells. And we already discussed in our previous lecture that if any tumor arising from columnar or cuboidal cell, cuboidal epithelium, we will call adenoma. If it is arising from the villi, it is a villous adenoma. It's oma meaning benign cancer. What happens if it is malignant? We can call as adenosarcoma. Adenosarcoma. That will be the malignant tumor of the columnar or cuboidal cells. So there will be no invasion in the muscularis. Tumor is growing like this. So it's a benign tumor. What about this tumor? It is again a benign tumor. This is the uterus. And these are the smooth muscle encapsulated a distinct border tumor. So the name of this one is, it's arising from the smooth muscle. So smooth muscle is a mesenchymal tumor. Sorry, mesenchymal. It's arises from the mesenchymal tissues. So it is called as the mesenchymal tumor. Mesenchymal tumor. There should be some name. Yes, if it is benign, we can call it adenoma. And if it is malignant, we can call it sarcoma. So, if it is benign, we will call it as fibroadenoma or just leiomyoma. We will call leiomyoma or fibroadenoma for the benign tumor. If it is malignant, we will call it as leiomyosarcoma. It will be the malignant tumor. And another name is fibroid. Fibroid is the another name of this tumor. It arises from the smooth muscle of uterus. Next one is the malignant tumor we will talk about. So the malignant tumors, so the term for disease in which an abnormal cells divide without control and can invade in the nearby structures. So malignant tumor, these are the abnormal uncontrolled growth of the tissues of the cells, and they can grow so rapidly. They are not well differentiated. They don't have a capsule, and they can invade in nearby tissues. So there will be metastasis. Malignant cells can also spread to other parts of the body through the blood and the lymphatic system. And this is what we call as the metastasis. So tumors which have metastatic capability, tumors which are highly proliferating, undifferentiated, usually mostly undifferentiated, and they can invade you. So these are the factors or the characteristics of the malignant tumor. What else? It ends as a sarcoma or carcinoma. It should be like S, sarcoma or carcinoma. So if it is arising from epithelial tissue, we will call as the carcinoma, like squamous cell carcinoma, and this one. And if it is arising from the mesenchymal tissue, like previous one, we will call it, for example, leiomyosarcoma, this one. So the malignant tumors are classically poorly differentiated. What are the characteristics of a malignant tumor? A malignant tumor, they are disorganized growth, not like a benign tumor, organized growth. Irregular borders, the borders will be irregular and poorly circumscribed. The nuclear, there will be nuclear pleomorphism. Nucleus will be different shapes. There will be nuclear highly atypia. The nuclei will be larger in size in different shapes. And hyperchromasia, the nuclei will be more dark. High nuclear to cytoplasmic ratio. The nucleus will be larger than that of the cytoplasm. High mitotic activity with atypical mitosis. There will be high mitotic activity at irregular places. There will be invasion through the basement membrane or into the local tissue. There will be metastatic potential, and the metastatic potential is a hallmark of malignancy. Benign tumor never metastasize. So if there is metastatic potential, there is hallmark for the malignancy, the malignant tumor. Secondary changes that we can see in case of malignant tumor, we can also find necrosis, we can also find hemorrhage, and we can also find calcifications. What else microscopically we can see? The most malignant tumors do not resemble the normal tissue of the origin, so there will be undifferentiation, less well differentiated, sometimes completely anaplastic, completely adifferentiated. Cells are often pleomorphic, different size, different shape of cells. There will be ATP of the nuclei and abnormal mitotic figures, the mitotic figures. What else? So here we can see that this figure shows an example of the uterine leiomyosarcoma. We said leiomyosarcoma, it means it's a malignant tumor of the smooth muscle. A sarcoma derived from a smooth muscle. It's a mesenchymal tissue. The tumor cells are spindle-shaped and resemble normal smooth muscles. However, they have a large pleomorphic nuclei with evident mitosis, including an abnormal ring-shaped mitotic figures. So you can see here, these are the smooth muscles, and these are the nuclei. See, where this nuclei is highly dark, this nuclei is highly dark, this nuclei is elongated, normal just like, and this one is highly elongated nuclei. So different nuclei. In this one you can see this is the mitotic figure. So there will be mitosis at the irregular places. So that is also the hallmark for the malignant tumor. So you can see in this image, this is the malignant tumor, a cross-section image of the malignant tumor. That is the leiomyosarcoma. So there are certain route of metastasis, how the tumor metastasizes. So the route of metastasis, it metastasizes usually through two routes, lymphatic and the hematogenous, through blood and through lymphatic system, but there will be some direct invasions as well. So a lymphatic spread is characteristic of the carcinoma. The tumors that are arising from the epithelial tissue, they have high capability to metastasize to different areas through lymphatic spread. Initial spread is to regional draining lymph nodes. Initially, for example, if the skin is here and there is a tumor arising, it invade the epithelium, it will invade the lymphatic or the blood vessel, then there will be lymphatic drainage to nearby lymph nodes. From there it will go to the different areas. So first initial there will be regional lymphatic drainage. Then there will be hematogenous spread, is characteristic of the sarcomas and some carcinomas. So hematogenic lymphatic is more common for epithelial malignant tumors, and hematogenous is more common for the mesenchymal malignant tumors like leiomyosarcoma and a lot of other examples. So in this there will be invasion to direct blood vessels. What are the other things? Renal cell carcinoma is the malignant tumor for the of the kidney, often invade the renal vein. They can cause occlusion and they can cause obstruction effect of the renal vein, leading to renal failure. Hepatocellular carcinoma of the malignant tumor of the hepatic cells, they often invade the hepatic vein because these are the close nearby structures. Follicular carcinoma of the thyroid, choriocarcinoma, these are the tumors. And another point of the seeding. So all these tumors, renal cell carcinoma, hepatocellular carcinoma, follicular carcinoma, choriocarcinoma, they have hematogenous spread because these are the tumors originating from mesenchymal tissues. While papillary carcinoma of thyroid more have the lymphatic. So next concept in this is a seeding. What does mean seeding? Seeding of body cavity is characteristic of ovarian carcinoma, which often involves the peritoneum, that is called the omental caking. There is a tumor like mucinous cyst adenoma of ovary. This tumor, because we know that the ovary, they are the intraperitoneal organ. So once there will be tumor of the epithelial lining of epithelial lining of the ovary, these tumors, they will involve and go and seed into the omentum. So you can see all these areas, these are the omental seeding of the tumor. And this is what we call as the omental caking. In this particular image, you can see that there is a metastasis of tumor to the kidney, to the liver. So it's a metastasis of carcinoma in the liver. So maybe from the GIT, usually from the GIT comes to the liver. So you can see multiple areas. If it is hematogenous spread, then blood will reach to different areas. That's why there will be multiple areas of tumor. So this was about the benign and malignant tumor. Thank you very much.